little bit about blood draw. You all must be scared of blood. Giving a drop of blood is really scary for everybody, and everybody goes to it. In your lifetime, you might be going to a doctor for some of your tests, and you have to give blood for the tests. I will not be talking about how the people take the blood, but some of the things which scare you while you give for your blood test. Normally what we do is we take a blood from the vein. We can take a blood from the artery also, but that is much more difficult and much more complications can be there for the arterial blood. Special people are required if they want to take your arterial blood. Mainly the doctors take that blood, or sometimes some experienced people also take that blood. Normally, when you go to a lab for your blood draw, it is the venous blood which we take. Why the venous blood? The blue veins which you can see, it is the blood we take from those veins. They are more superficial veins, easy to tackle and less painful, and they have got very thin wall. That is why we take the blood from them. So many questions come to your mind when you go to a lab for your blood draw. One is, why is it important for you to know about the blood draw? Because you will need it in your lifetime. So questions will be coming to you. I have to go to the doctor. Will it be painful to me? Will this blood draw will be painful to me? And how much blood they will draw from me? Will it give me some disease or not? So all these questions will be coming to your mind when you go to the doctor. So I want to increase your knowledge here that when you go to the lab for the blood draw, it is not painful. There is a little pain like the pinch here. That's it. It is not painful if you are in good hands. And normally they take the blood in one prick only. And they take very little amount of blood, which is not harmful for your body. Which is not harmful at all for your body. You don't get any disease when you are giving your blood for your test. You do not get any disease from the person who is taking your blood. Because he is following all the protocols. He is following all the protocols of PPE when he is drawing your blood. His hands are clean. He is putting on the gloves, and he just give a single prick to you and draw the blood from you. So you are not to be scared of it that you will harbor some disease from the person who is taking blood from you. So this is the anatomy of this is we call antecubital fossa. So here we draw the blood. This is the most commonly used site from where we get the blood. So this is the vein. This is the vein we choose most of the times. The middle one here. This is called the median cubital vein. This is the vein we choose to draw the blood. You might have noticed, how many have you gone for the blood draw till now? Given a sample. So this is the vein we normally choose here. Why we choose this vein? Because it is very superficial, a good vein. It is easy to draw the blood from here, and it is very painless. Little pain is there because nerve endings are not near it. That is why we draw the blood from here. Other veins which are lying close to this and this, they can be painful also, and they are lying, especially the basilic vein, it is lying close to the artery also. So we don't prefer these veins, we prefer the middle one. This is called the medial cubital vein. First of all, this is important for you. When you give your blood, you should wash it at home, or go there. The nurse or the whosoever is collecting your sample, they will clean the site properly. That is important for you to watch. Because if the site is not clean, then you can get some infection when the vein is pricked. From the infection lying outside the skin can go into your blood, can be bad for you. So cleansing of the site is very, very important. Normally, we clean it with alcohol. So after we clean it with alcohol, we dry